People can live with psoriasis all their lives. They can live with rosacea or acne and they're all fine. But the moment you get a little bit of hair thinning, I looked into the mirror and I can't even recognize me.
Let's talk about smart longevity strategies. As a Gen X mum, founder and podcaster, my days can be long and demanding. That's why I love learning about longevity and cellular wellness breakthroughs that work hard and smart. Time Capsule by Melrose Future Lab is the first TGA-listed all-in-one longevity supplement. It combines 12 clinically backed ingredients in one daily formula to support energy, metabolism, cognition, cardiovascular health, bone strength, and antioxidant protection. Powered by Lipisperse and Verisperse for enhanced absorption, it includes niacinamide riboside for cellular energy, resveratrol antioxidant defense, and berberine to support glucose metabolism. Plus essentials like activated B vitamins, magnesium, vitamin D3 with K2. Because real longevity is not just about one thing. It's sleep, nutrition, mindset, and yes, supplements. It's about everything working together. Time Capsule makes it simple. Dr. Leona Yip is a Melbourne-trained dermatologist and fellow of the Australasian College of Dermatologists with a subspecialty expertise and PhD in scalp and hair loss disorders. She is one of Australia's leading authorities on female hair health, combining deep scientific knowledge with a holistic, patient-centred approach. Now based in Brisbane as Director of Skin Partners, Dr. Leona Yip also serves as the head dermatologist for Cricket Australia. Her career spans private practice research and media, and she's widely regarded as a trusted medical voice on skin and hair health. She consults for leading pharmaceutical and skincare companies, sits on expert advisory boards, and is deeply committed to improving public understanding of skin and hair science. In this conversation, we explore the complex and emotional terrain of scalp and hair health, from hormonal and age-related changes to emerging regenerative treatments. Dr. Yip shares her insights on why women experience hair loss in midlife, what truly drives follicular aging, and the promising role of exosomes, topical therapies, and holistic care in restoring both confidence and vitality. I am so excited to introduce Dr. Leona Yip to the episode. Dr. Leona, it's so nice to be reunited with you, and this time on the show. Last time I saw you was in Brisbane for Ageless Radiance Club.
Yes, thank you so much for having me again. So lovely to see you. I'm very excited to record this.
I reckon today's topic is in my top 3 of DMs that I receive. We are talking about hormonal hair loss and scalp health and how and if we can turn this around. And I know that you are a dermatologist with a very keen interest in hair. And so it felt like a very natural conversation for us to have. And I can't believe we haven't had it earlier.
I know hair is just so sexy at the moment. Skin care, anti-aging has been around for a while, but I think skinification of hair seems to be this trend that's now exploding. And there's just so much misinformation out there. So I'm really happy to be here, have a chat about things, go with the science-backed evidence and how we would treat hair loss, because I think it's really important to filter out the noise that's in social media at the moment.
Could we start at first things first? What are the early signs of hair loss that we should probably be catching? Because as I understand it, the science says if you can catch it before and if you can improve the conditions of the skin before, you're going to have a much better chance of recovery and also prevention. Is that correct?
That's totally correct. So it's much easier to treat early or mild hair thinning than to treat it along down the track when it's more advanced, because the longer you wait, microscopically, there would be some scarring around the hair follicles, which would make it more difficult for us to achieve regrowth. So one of the first signs that women should look out for would be a bit of thinning on the temples, a bit of recession there. Sometimes it's normal with age, but it can be a first presenting sign of thinning. And then later on...
So just around the temple?
So here,
Yes, I've had that before. Like, look
yeah,
how much hair I have. And yet I noticed that in after menopause, really.
yeah, yeah, yeah. So that can be the first presenting sign in some women, not all. And then we have hair thinning, which is when your individual hairs start to feel finer and thinner than they used to be. You get what we call the Christmas tree pattern, which is where the hairline, the central part line, becomes more gappy over time, like a Christmas tree. And the base of the Christmas tree is at the front. So a lot of women can present with that little bald patch or just quite obvious scalp at the front there. So that's the base of the Christmas tree. And over time, that central part line becomes gappier. And then you can get thinning through the sides of the scalp and on the crown. The other very common presentation that we have dismissed for years is an increase in hair shedding. That is also a sign of female pattern hair loss, because what we see is a reduction in the duration of the hair growth cycle. And that's why you get more shedding, because the hairs can't grow to the desired length that it used to be able to. So increased shedding and your hairs grow finer, thinner. And in many women, you can't get to the length that you used to be able to grow. So in a lot of my patients, I would recommend that the older you get, if you find that your hairs are thinner, your ponytail gets wispier, cut your length a little bit, layer it. That gives it the illusion of fuller hair.
So I love that our dermatologist is giving us some styling advice. But also, what I hear from what you're saying, which is so, so important, is to be aware and to kind of be your own monitor, not in a paranoid way, but kind of in a natural self-assessment way, and to catch some of those early warning signs. I want to go to how hormonal shifts specifically will impact hair growth, hair loss, hair thinning, the Christmas tree, or any other thing that you talked about. How is because we know that hair loss happens for a number of different reasons, but let's
Mm-hmm.
talk now about the hormonal reasons and the impact and why.
Yeah. Okay. So you are referring to female pattern hair loss. I don't like to call it hormonal hair loss because it gives the illusion that many women have abnormal androgens or have higher circulating androgens or androgen excess that leads to female pattern hair loss, but that is not the case. In the majority of women with female pattern hair loss thinning, you have it because there's a genetic predisposition that makes your hair follicles more hypersensitive to any presence of androgens on the scalp. And these androgen hormones bind to androgen receptors on the hair follicles that drive hair follicle shrinkage or miniaturization. And that is why we don't do, just a call. I'm going to say that again.
Yep,
I've just
we
missed
can
you
edit.
there.
That's fine. Lachlan, are you getting things dropping in and out?
Ah, bloody hell.
Leona, can you speak more loudly, darling, so that we don't get the ebbs and flows in it? Thank you.
Yep. That's
Cool.
all good. Okay, so I'll start again. Sorry about that. Where was I? So coming back to the term hormonal hair loss, I don't like to call it hormonal hair loss, nor do I like to call it genetic hair loss, because we know now that environment, lifestyle factors can play a role as well in hair thinning. But what I'm trying to get at is the vast majority of women do not have abnormal hormones. And that's why we don't do hormonal testing in the majority of women, including in peri and postmenopause when they present with hair thinning. Now, I also like to point out that whilst many people, including doctors, blame a lower level of estrogens during perimenopause and menopause as the main factor for hair thinning, this is oversimplified because in perimenopause, you get fluctuations in your estrogens, progesterone, androgens. There's a huge myriad of hormonal shifts. So let's put it this way. If estrogen alone is to be blamed, 100% of women with perimenopause and postmenopause have lower estrogen levels.
Yeah, that makes sense.
Yeah, so to quote you statistics, 40% of women by age 50 have female pattern hair loss, and by age 60, 50%. So it's less than half. So estrogens alone, if you blame it, it does not make any sense. It does not explain the whole phenomenon. So rather than just one hormone, I think it's more fluctuations in the ratios of progesterone, estrogens, and androgens. And if we look at scientific literature, and I looked at this when I did my PhD more than 10 years ago.
And what's interesting, as I said in the introduction, is in addition to your medical training, you have a PhD on this topic.
Yes, so I looked at the genetic basis of female pattern hair loss in my PhD and also hormonal influences in hair. But scientific literature is conflicting. It does support beneficial effects of estrogens, but there are also some reports and studies that support detrimental effects of estrogens on hair. So this is why using estrogens, using HRT to treat hair loss is not standard treatment. There are ongoing research at the moment. So in time, things may change, but in 2025, we don't know exactly what hormonal mechanisms underlie more hair thinning or acceleration of hair thinning during peri and postmenopause.
Well, I don't know if that's good news or bad news, but for me, I can understand why someone in your position is frustrated. And we've had this conversation before when, over-the-counter products where cosmetic products say, rub this oil into your scalp and you're going to see massive hair regrowth. If it was that simple, there would be no hair loss issues and it wouldn't be such an enormous industry. When women Google, why is my hair thinning? The response is just crazy. I mean, there are so many reasons. We've talked about the hormonal impact. Can you talk about other presentations that you see in clinic for hair loss in women that you test for or assess?
So firstly, I think there's a lot of confusion and a lot of people still don't realize the difference between hair thinning and hair shedding. And this is also true amongst health professionals. So one of the first questions I would ask my patients when they come in for a hair loss consult is, are you just experiencing thinning hair or is there shedding as well? Or is there patchy hair loss? So hair thinning, as I defined before, would be your individual hairs get finer, thinner, your hairline gets a bit wider. And because in the vast majority, this is a genetic predisposition, and in the vast majority, there's no androgen excess, very rarely do we need to do hormonal testing or any sort of other tests.
Can I just interrupt? Sorry, just for anyone who's listening who doesn't understand what androgens are, could you just explain that terminology for us as well, please?
Yeah. So androgen hormones are what traditionally we would call male hormones, which are testosterone, DHT, and we've got the female hormones, which are estrogens. So in women and men, in women, let's specifically talk about women, we have androgens, we have estrogens occurring in different ratios to help us with our sexual organ production and with childbirth and with our hair growth. So with androgens that we talk specifically in hair, we're talking about testosterone or DHT, which is dihydrotestosterone, that the hair follicles are more sensitive to, that can drive the hair loss process. Does that make sense?
It absolutely does, but I think it's important to just have some definitions. So going back to the query about is there hair shedding or hair thinning?
Yes.
So if there is hair shedding, what happens? What are your concerns around that?
So I'll just quickly finish the hair thinning part. So I said before, we don't do hormonal testing, but in situations when there are suspicions of polycystic ovary syndrome or any suggestions of an androgen secreting tumor, like with rapid onset or rapid acceleration of thinning, say over weeks rather than over months, that's when it should be a red flag and your doctor should be testing your hormones. So that's hair thinning. Hair shedding can be a presentation of thinning, but hair shedding can be non-specific. It can also be a reaction to stress. It also can be a presentation of underlying nutritional deficiencies or metabolic problems, such as thyroid dysfunction, really low iron, really low vitamin D, or autoimmune problems. So in those conditions, on a case-by-case basis, we would test for these markers in the blood. So that would be when we would start to think about doing these investigations. But to be honest, I very uncommonly would do these tests because often it's a clinical diagnosis.
And how often would you ask your patients to have blood tests? Or is mostly if I came to see you as a patient or if someone who's listening went to a dermatologist who specialized in hair loss, what would be a normal consultation protocol? What do you think we should be advocating for ourselves? I have a special ageless listener offer. Ready to simplify your longevity stack? Our season 11 sponsor, Melrose Future Lab, is offering ageless listeners 40% off your first time capsule order. Just use the code AGELESS at checkout. T's and C's apply. Offered valid on one-time purchases of time capsule. Only available now at melrosefuturelab.com.au.
I think if you're presenting to a GP first, it's very reasonable and it's standard practice for GPs to order these tests to exclude underlying associations such as severe iron deficiency or low vitamin D or thyroid problems or autoimmune issues, and fix those if they need to be fixed. When they come to me as a specialist, so a lot of women, the shedding would settle if it's female pattern hair loss on treatment. And sometimes they go on iron replacement. It may settle, but not always, because hair shedding can be multifactorial. There are some women in my patient cohort, probably about 10-15%, the shedding just would not resolve, regardless of what tests you do, regardless of what treatments you have. And in these patients, it's likely because it is the female pattern hair loss, the hair cycle is going around faster, that's causing it. But I also find that there is some sort of internal inflammation, like an autoimmune problem brewing, or they've got some gut issues or whatever it is that's driving that shedding. And so the shedding is a reaction to an internal problem and not a diagnosis on its own. So regardless of what test you do, you're not going to find a cause. Having said that, I would probably do a yearly test just to make sure that I'm not missing any new thyroid problems or iron deficiency problem or an autoimmune cause.
You know, I always get this question, how many tests should we be having? How many specialists, do we need once we're in peri and menopause? And I think that this is such an interesting conversation because hair loss is one of the, quite common, as you said, with the statistics, and quite devastating from a emotional impact.
Oh, absolutely. Yes.
Where do you see the role of non-medical intervention? How far can we help ourselves before we have to come and see a specialist?
I think in the first instance, it's really important not to go down that rabbit hole of spending hundreds and thousands of dollars on every hair growth serum, every snake oil you see on social media. And snake oils include things like rosemary oil. So I always say, trust science, not rosemary oil. There's so many things out there that are based on very weak evidence. So the moment you click or you search the term hair growth serum or what to do for hair loss, is like vultures. All these marketing ads come swarming into your social media and your Google search. So that's number one. Don't get bogged down by the noise. You can try some hair growth shampoos and serums. Active ingredients that you could look for would be aminexyl, stamoxidine, copper peptides. The weaker ones like saw palmetto, caffeine, I don't tend to recommend it. I also don't tend to recommend anti-dandruff shampoos for hair thinning. If it's for dandruff, it's a different story because the evidence for these are quite weak. I view active ingredients in shampoos, hair growth products like skincare for hair. So I would recommend that as an adjunct to my treatments, but they do not replace medical therapy. So I explain it like, if I treat your acne, I still need to recommend you good skincare. Same thing for your scalp and your hair. So once you've tried that for about 6 to 12 months and nothing's really happening, you're progressing, see your GP, filter out the noise. And you don't need extensive tests. There is no role for heavy metal testing or urine testing for trace metals. No evidence whatsoever. So
that would be more in the realms of naturopaths and complementary medicine. So you're saying the GP should be able to run a couple of simple tests that will rule out whether it's deficiencies, and if those have been ruled out, then the next step would be to get a referral to a specialist such as yourself. Got it.
Yes, that's right. Yeah, that would be what I would recommend. That's the usual pathway. Otherwise, you end up being dismissed for months and years with over-the-counter products that don't work, a lot of money, seeing lots of people who may not know how to treat hair loss, but think that they do. Unfortunately, that's a reality of the situation.
Can I ask you how much of it in the regenerative medicine space and in the medical and prescription space is promising? And because I would assume that even in the medical scientific um, prescribed space, there are things that are more effective than others and some that, are dated.
Yes. So in 2025, first-line treatments for hair thinning, female pattern hair loss, is still going to be prescription medicines. We would use
Prescription medication.
medications, yes. They would be using a combination of anti-androgens and hair growth stimulants like minoxidil, oral minoxidil. Anti-androgens such as spironolactone or bicalutamide, we use that because it works like a handbrake to slow down progression of thinning. Any regrowth on anti-androgens, I would consider it a bonus. But regrowth on minoxidil, that's an expectation of treatment. So that's why we use combination therapy. But we are lucky in 2025 and practicing in hair loss medicine in this space, we are seeing so much disruptive biotechnologies.
Yes, I know. I've just come back from Korea and like scalp and hair health and hair growth. I mean, wow, that's
it's very sexy at the moment. Industry is investing a lot in it. And this space is moving so fast because unlike prescription medicines where we're bound by regulatory standards, we know we need clinical trials, we need data for safety, efficacy. The biotechnology space does not. So that's why, and it's also a lot more accessible beyond medical professionals. Anyone can do it. But that also needs to be faced with cautious optimism. I'm very excited in the first time in more than a decade of practicing in this space, I can access these biotechnologies that have really changed the way I treat hair loss because I can be less reliant on just medicines to achieve regrowth for my patients. But then also there comes the need for responsible, discerning decisions because not every hair regenerative therapy will work for everyone. Like PRP, platelet-rich plasma, I've phased this out completely now in my practice entirely because using it for 5-6 years, I don't find it offers much value. I now use more treatments like exosomes or laser-assisted delivery of growth factor serums. I do autologous scalp tissue micrografting. So there are a lot of other technologies.
What does that mean? What does autologous scar tissue micrografting mean?
Yes, I should explain that. So that's using your own biological stem cell precursors. It's a procedure called regenerative, where I take 3 little punch biopsies, 3 little pieces of tissue, scalp tissue from the back of your scalp where hair density is the healthiest and thickest. And we process it through a specialized machine that will filter out stem cell precursors called progenitor cells. And we've got over 5 billion exosomes. And exosome is a buzzword to describe bioactive signals like growth factors, genetic materials, proteins that can boost and stimulate regrowth and optimize your scalp microenvironment for hair regrowth to happen more easily. So the progenitor cells, which are the stem cell precursors, so we inject all of this into areas of thinning.
So this is very different to PRP. So we're not talking about blood plasma. We're talking about
taking scalp tissue, hair follicle tissue, healthier hair follicle tissue, and we are donating stem cell precursors, which theoretically, because progenitor cells are very high up in the cell line and differentiates into different tissues, including hair follicles. So theoretically, it has the potential to reprogram thinning hairs to slow down more thinning. So it can change the progression. And with the exosome bit, it's your natural exosomes. It can boost regrowth. So I do that a lot in my younger patients presenting with
that's what I was going to ask. So are there why don't you do it on everyone?
No, because the quality of your own stem cell precursors and exosomes would dwindle over time with age, like PRP. So patient selection is very important. There's no cookie cutter approach. So my advice to listeners is if you are investing in these treatments and the out of pocket for any treatments that you choose, regardless of what type of hair regeneration therapy, you will be spending at least a few $1,000s on it. You need someone who is experienced, who is properly trained, and is credible to decide whether or not that treatment is right for you. And often it's in combination with medications.
Can you see from a patient's perspective and a listener's perspective how this might actually rule out treatment, professional treatment for a lot of people, which of course then sends us down the aisles of supermarkets, pharmacies, online to find a magical solution for hair loss, whether it be through stress or hormones. So I'm wondering, are there anything that is, within a normal budget and which is practicable for most people to try that you recommend as an expert that you think is a worthwhile investment?
Okay. So firstly, we need to decide, is your hair thinning early or mild or in the preventative stage? If it is, it's much easier. You can go down the track of using a good quality hair growth serum, shampoos to boost regrowth, to sustain your scalp health. There are general measures that you can take. As I've mentioned before, we know now that scalp aging, hair aging, including thinning, hair graying, hair shedding, that accelerates with lifestyle environment factors like UV, pollution, cigarette smoking, stress, too frequent styling, chemical dyeing your hair. All these are very easily addressed. Any scalp inflammation problems, psoriasis, eczema, seborrheic dermatitis, or scalp dandruff, treat it. Cheap, nice and easy.
Do you think that you mentioned this, and I've wanted to ask this question a couple of times. A lot of the messaging in the cosmetic side of scalp care is to exfoliate your scalp. So there's a lot of scalp exfoliators, scalp cleansers, scalp masks, scalp AHA, BHA solutions. Do you have any recommendations on the cleanliness and the environment of the scalp that we can manage ourselves?
Absolutely. So when I see hair loss patients now, one of the first things I would always assess for is their scalp health. If their scalp is not healthy, what's the point treating the hair loss? The hairs will not grow properly and it will shed more. It accelerates thinning. So I always would recommend for most people to wash your hair frequently and regularly, every day or at least every second or third day.
Can I ask what you wash your hair with?
I wash my hair every day. So I actually use a combination of different products. I use Kerastase. There's Kerafactor that I stock in my rooms that I use as well, but I would change it. It's like skincare. Sometimes in winter, I need something more moisturizing. Sometimes in summer, not so much when there's more frizz. So just like skincare, you would need to think about changing your hair care products to suit your lifestyle, environment, and the climate. So washing your hair regularly, more frequently, particularly if you sweat a lot, you exercise, there's a lot more pollution these days. People use more hair care products, there's greasy scalp. So that myth about you can only wash your hair once a week is not true. Throw that out the window. So that's the first thing that we should be addressing. Exfoliating shampoos are important. I would suggest you do that once or twice a week because just like our skin, sometimes you get built up of product debris and you do need to get rid of it on the scalp surface. So it's healthy. It helps to balance your microbiome. It helps your scalp barrier function. And for swimmers, in Australia, we're a nation of swimming. And often swimmers don't necessarily think about the health of their scalp. So exfoliating is also very important because chlorine is quite harsh. And any sort of harsh activities you do, like if you sweat a lot, you wear helmets. If you're a FIFO worker, if you are a long distance cyclist, all these things need to take into consideration when we're treating hair loss as well. So that's why it's never a short consult.
You mentioned scalp, a simple scalp serum. I'm sorry that I keep asking, but I'm looking for like things that most people can afford and can take away from this episode. So are you saying that there are some over-the-counter scalp serums that you think are worthwhile, that are anti-inflammatory, that are going to be? Can you share with us what they are?
So I have looked into this myself. And to be honest, unlike skincare, it's really hard to find good quality, science-backed scalp care products.
That's why I have you on the show today. That's why I had you speak at the event. It is so hard to navigate, way harder than skincare.
Yes. The industry is massive, but there's just a lot of snake oils out there. And because I'm a dermatologist, I don't get brands coming to me trying to tell me what their products are. They go to hairdressers. So I have to say, my knowledge of brands to recommend my patients are ones that I try myself. I pay for it myself, and the ones I would recommend. So let's talk about active ingredients first, and I'll recommend a few brands that people could try.
Perfect.
So looking for ingredients. So think about your scalp as an extension of your facial skin. So what you use on your scalp is quite similar to what you would use on your face, like using glycerine as a moisturizing agent, vitamin E as a moisturizing agent and an antioxidant, niacinamide, panthenol. And for exfoliants, glycolic acid, salicylic acid can be quite helpful. And then we talk about brands. So if you are confused and it's easy to just think about, just give me a brand because I don't want to know what else.
Give me a few.
Okay. So Kerastase is a fantastic range because there's quite a lot of science that goes behind the formulation and the quality of their products, but it's quite heavily fragranced. So for the listeners who have fragrance allergy or sensitivity, that's probably not the range for you. I like K18 as a range. I think they're fantastic products as well. So that'll be what I'd recommend. I like this German brand called La Biotechnologies. I think that's what it's called, using it correctly. So that's also a really good one. Dercos is another good one. But
do you know, I switched all of my hair color to La Biotechnologies because it doesn't hurt my scalp, and it really was a game changer because, of course, one of the fun things about getting older is the grays, and so you have more frequent hair dyeing, and so I switched to La Biotechnologies for
I actually really like that brand. Yeah, so these are the main ones that I would gravitate.
What about pharmacy brands over the counter? Is there anything that you think is a little gem and worthwhile?
I think coconut oil. There's one
coconut oil
for moisturizing. So that's like $14 product.
Yep.
It starts with an O. I can't remember what is it, but it's a clear bottle with a gold cap. You can get it for $14 in Woolies or like Coles. I would tend to recommend that people
I need you to tell me what it is so I can put this in the show notes because everyone's going to want to know what this $14 product from Woolies is.
I will find that for you. And I would tend to recommend to use that as a moisturizer for your ends rather than, I don't really like the idea of oiling scalps because that can aggravate risks of dandruff and seborrheic dermatitis.
Okay, so stay away from the scalp, more for the ends.
Correct. Yes. Yeah. Unless you've got a really dry scalp, you may benefit from a little bit of oiling, but for most people, I would not recommend that. Otherwise, it is dandruff, seborrheic dermatitis is so common. It would just make your scalp a bit more inflamed, a little bit more unhealthy. So that's one good one. But the L'Oreal Elviva brand is also quite good. But the key is to choose products that suit your hair type and whether or not you treat your hair with dyes or with bleaches. That is probably one of the most important key factors. People are not choosing ranges that suit their requirements. It's like skincare. You can't just go in there and choose one thing. And the other thing I'm also going to say is do not use baby shampoos on your scalp. That's not suitable for adult scalp because baby shampoos are formulated to be alkaline. So it matches the alkaline pH of baby's tears so it doesn't hurt their eyes. It's not suitable for adult use because our scalp skin and our hair is a bit acidic. So you will disrupt the scalp barrier and you can cause problems with dry hair if you're using baby shampoo.
I want to finish up with the question of identity because I know that a lot of women have such an emotional connection to their hair as their identity of youth, of beauty, of style. How do you manage that as a dermatologist who is, a woman of science, but you also have to navigate the emotional impact of the work that you're doing with your patients? And what advice would you give to anyone who's listening, who's really suffering on the emotional side of things?
There's just something about hair. People can live with psoriasis all their lives. They can live with rosacea or acne and they're all fine. But the moment you get a little bit of hair thinning, because it's hard to hide, and truly it is quite poignant that it is your identity. One thing that one of my female patients said to me about her hair loss that really stuck with me, she said, I looked into the mirror and I can't even recognize me. And that really hit a chord in my heart. And having been an alopecia specialist for more than 10 years now, I've seen the impact of hair thinning on most people. And I've been through it myself when I shed a lot of hair, when I stopped the contraceptive pill years ago after childbirth. It is quite traumatic. It is quite scary. And going bald, and because you can't hide it, it is a true identity crisis. So the first thing I want to say is do not dismiss hair loss concerns. I know many medical professionals do it. Family members, friends do it. I have patients that come to me and go, I don't know if I want to keep going with treatment. Like, why? Are you getting side effects? No, because my daughter said I'm just vain. And this patient said that to me last week. My GP just said it's aging. There's nothing you can do. That's the other thing that I do not like people saying. There's nothing you can do. There are no treatments. Of course there are treatments. There are plenty of options. But how you respond to treatment is different because everyone's journey is different. So don't let anyone tell you there are no treatments. And the other thing I've also learned is I would not suggest a camouflage like hair wigs or hair pieces to patients before they actually decide to discuss that subject. In most people, they don't need it. And they're thinking about it because they think there are no treatments. So if you are suffering from hair loss, remember that you're not alone, but do filter out the noise. There's a lot of misinformation out there. Seek proper help. Get informed about your treatment options, and then you can decide what you want to do. So my consult style is I see myself as someone to tell patients or to guide patients, this is my advice. This is your best option. But if you're uncomfortable with prescription medicines, we have got hair regeneration therapies to buy you time, or if you're pregnant, breastfeeding, or you're going through perimenopause, your GP is trying to sort out your HRT, we can hold off prescription medicines and do something else. So there are always options. And I think it's important to tailor those options to our patients and give them back that empowerment to make that decision themselves, give them back that control. So that's how I would consult, rather than just saying, take it or leave it. You've got anti-androgen minoxidil. If you don't want it, there's nothing else you can do. Of course, that's not true, but that's just my style.
Well, I love your style, as you know, both figuratively and in real life. And I want to thank you so much. This was just such a great conversation and such a worthwhile conversation. I actually have never heard all of these options presented, and I think it's very heartening to know that there are many different approaches for different budgets, for different reasons, for different stages. And I want to thank you so much, Dr. Leona Yip.
Ring me.
Just a joy to see you. Thank you.
You.
Thanks for listening. If you enjoyed this episode, please subscribe to the channel, sign up for our free newsletter, and consider leaving a review and rating it. This really helps the channel grow and reach new audiences.